What if I told you that you can work in Sweden as a doctor or a nurse or any other healthcare professional in just 5 simple steps? So in this video, I'm going to be talking about how you can apply for a license in order for you to practice as a nurse, doctor or any other healthcare profession here in Sweden. So let's get started. Hello and welcome to my channel. My name is Aditya, and those of you who have subscribed to my channel, you know that I make informative videos about Denmark and living here in Europe. So without wasting any time, let's get started. Today's topic is for the nurses or the doctors or any other healthcare professional here in Sweden and how you can obtain the license. So before we get started, I would like to say I'm making this video based on my own research, and people I know that who worked in this profession, they share their experiences, and that's why I did the research and making this video. So if you like this video, do subscribe to my channel and give a like. So why Sweden? Why people choose Sweden over any other European countries? So let's look at that. Working as a healthcare professional here in Sweden is a fantastic opportunity. The country has a top-notch healthcare system that values both patients and practitioners. You will have access to advanced medical technology and be part of supportive, collaborative work environment. Sweden's commitment to work-life balance ensures that you can enjoy a fulfilling career while also having a time for personal life. The inclusive and gender equality society, along with the high quality of living, makes Sweden an ideal place for healthcare professionals to make a positive impact on people's lives. Joining the healthcare community in Sweden means contributing to a system that prioritizes well-being of happiness for all. And that's why most of the people choose Sweden to work in a healthcare profession. So let's look at the 5-step process that is involved when you have to apply for a license to work as a nurse or a doctor here in Sweden. And the process starts with assessment of your degrees or education that you have received, and then in the end you have to go for a clinical training, and then you can apply for a license. So here in front of me, you can see it on the screen that you go to the website called Legitimation Socialstyrelsen. The Socialstyrelsen is the healthcare website of Sweden, and then here you can go and apply for the process to get started. So you have to choose your profession here. For example, if you're a doctor or dietitian, dental, and all the other, see there's a lot of options: nurse, responsible, general case, and all the other things that are mentioned here. But let's look at the doctor. It doesn't matter what profession you choose because it is similar process in every profession. So let's get started. So we'll find a doctor of medicine here. Then they'll ask you if you have received your education inside the EU country, in Sweden or outside. So for the purpose of this video, we'll see outside of EU. And then if you have worked in the last 3 years inside EU country, no, let's say that, and then you go ahead. Here you can see it gives you an overview of how it looks like and what are the steps that are involved for you to take the license. The first one is the assessment of your education and qualification, that is your degree and diploma that you have. So the next one is the proficiency test, where you will be tested all the skills that you have acquired as a doctor or nurse in your own home country, and that will be in Swedish. So of course I will come to that in a minute. And in the third step involves you taking a course in legislation or law in Sweden, because different countries have different rules, so you have to follow those guidelines, and that is where to take that. And the fourth one is you have to go under the clinical training, and then that's your probably internship or assessment of your whole process, because when you get a positive assessment there, then you can apply for the license. And the last one is you pay the application fees, fill out the form, and then you get your license. So let's look at the first steps. So the first step involves to get your education assessed. So normally the assessment takes up to 3 to 4 months, they have mentioned on their website, and you just have to be mindful of that, because a lot of people write me that it takes a lot of time. What is the process? And it also depends when you're applying If you're applying just before the holidays, especially in winter holidays or in the summer holidays or during the Christmas holidays, so it takes a little bit time. So it can add few more weeks, like 3 to 4 weeks more into your processing time. So the application must contain an application form that you can download right over here, and a copy of first page of your valid passport, of course, and if you have a Swedish ID, you can also provide that, and a copy of certificate of completion of education, for example your diploma, and a copy of your certificate lists the courses that you took long the program lasted. Okay, so this one is important because you have to make a proper documentation what were the courses that you took while you were studying, and how sometimes you can get the whole curriculum on your college website. Most of the college websites or universities have that, because what were the content of the course or curriculum and how many hours were involved in learning that, or whatever, if there were some practicals, how many hours of practical work was involved, and all the other things that you have to provide. Make a documentation of that and you can provide that. And copy of a certificate shows changes that you have made. If you have changed your name or something, or then you have to provide that. So of course you download this form, fill out the application form, and then all the documentation necessary. And then if your documentation is not in English or any other language, then please translate them into English or Swedish, and after translation you can get them attested, or so it is verified that is original copies, and then you can scan those documents. There are two things you can do. You can send all the documents by post for an assessment, and you can also send an email. So make sure if you send an email, it has to be in PDF format, and you have paid. The interesting thing is that it is completely free of cost, this assessment, and as of now it might change in the future. So if you're applying, so keep that in mind. You don't have to pay for assessment, and you don't have to know Swedish language while you getting this assessed. So once you've done that, you can send an email. Here it is provided for you email where you can send all the documents, or if you are considering sending by post, you can send it here. There is an address here. And if you have any other questions, you can look through this, and that will give you a good idea of what is to come. So let's say you have received a positive assessment, then you go to the proficiency test. But before you go to the proficiency test, you will get a letter from Swedish authorities that okay, your assessment was valid, and then we can give you permission to come to Sweden and learn Swedish or apply for proficiency test. So a lot of people, sometimes, like I said, it can take up to so many 2 to 3 months for processing. In that meantime, you can study Swedish. There are so many online platforms where you can study basic Swedish before you come to Sweden. And when you come to Sweden, you can take the high level of Swedish and complete the Swedish language course, so you can understand and what you're going to do in the proficiency test, because proficiency test is in Swedish. So once you come to Sweden, and then you have done your Swedish language test, then you apply for a proficiency test in the university called Umeå University. The link is provided right over here. You can see on my screen, and that the test consists of both theoretical and practical. So what if there is a lot of questions, people were asking me when I made a previous video about other countries, and what if you fail the test? What do you do? I know it's a sad reality, but sometimes it could be difficult because it's not your first language, you're giving it into other language. Of course, if you fail the test, you still get 5 attempts and 5 more years to complete that, but nobody wants to wait 5 years. So that totally depends upon you, how you understand the language and you clear the test. So let's say you clear the test, and then what do you do? The next one is you have to take a course in Swedish law and regulation, because here in Sweden and in Denmark and European countries, there are different communities, regions, municipalities, and regions where they have different laws Especially so if you're going to be working in Sweden, you have to know what are their laws, what are the guidelines that are provided by the hospitals, and that's why they have to follow that according to the rules made by the government. So you have to be aware of these laws. So you have to take those courses before, so you understand what it means to work in a healthcare profession and what are the things that you have to be careful while you look at the patients or their families. Yeah. So for this you also have to find you have to register yourself to the course at the same university. The link is provided right over here. So in this university you find that course. It's called Take Swedish Law and Regulation, and you take that course, and that will be also in Swedish, so it's important that you know Swedish. So you cannot go through step number 2 and 3 and all the rest of the steps without not knowing Swedish. So you have to be aware of that. And then once you have done that, the step 4 involves undergoing the clinical training. That is your internship. That's the most important one, because here you will get tested. All your skills that you have acquired will be tested in practical life. Then you will get to know how the Swedish healthcare system works and what are the things that are involved, how they do it. And it lasts for 6 months, but you can extend it to 1 more month. That depends upon your preference. But you have to be careful and mindful of that you don't get paid during this internship. I know in Sweden you don't, but for example, if you were in Iceland or Denmark, they get paid, and that also depends on which region, which municipality you're working in, because every region and municipality have their different budgets and only some amount of money they can spend on things like this. But yeah, and the position of the traineeship or the training, you have to find it yourself. They will not help you with that, because but if you have gone through this process and come so far, and it should not be difficult for you to find the position, because they need a lot of healthcare professionals and doctors and nurses here in Sweden. And that is why on the website of their hospital you can always find the vacancies or the traineeship. And especially when they don't have to pay you anything, it should be fairly easy to get that. Yeah, once you start that, you have to do this traineeship for 6 months, and upon completion you will get a feedback from them if it's a positive or negative. And what do you do next? So next step is for you to apply for the license. So for apply license, you go on to the next step. Here you can see on my screen, you have to pay the application fees, and then you can apply for the license. So with regard, you have to come here and complete the application form. You can download the application form right over here. There is a link to download the application form, and then you have to provide the necessary documentation, which will of course involve your copy of certificates of Swedish proficiency that you have, and then your passport copy and complete application form, and documentation stating that you have passed your traineeship or training that you took for 6 months. And what do you do? Then you can just apply for it and wait. And once you received, and of course if you have received a positive feedback from your training, then there's no way you can not get the license. Of course you will get the license when you have received a positive feedback. And then you can work in Sweden as long as you want. Then you just have to keep in mind that you have to change your visa type and stuff, because there's a different visa you're on right now. So that instructions will be given after each and every steps when you follow this. Yeah, what else? One thing that I didn't mention, because a lot of people ask me, can you work while you're going through this process? Of course you can work. You just have to be mindful of that you take the permission from the immigration. You have to change your visa type, and then you can work while doing this. But if you cannot call yourself doctor or nurse and work like them until you get the license. But in some different profession, for example assistant nurse or dental nurse, you don't actually need license to practice, or in pharmaceutical. So you can actually work full time if you like. if you don't need a license to practice that here in Sweden. So if that is the complete steps, you can follow and apply for license so you can work as a doctor, nurse or healthcare professional here in Sweden. If you have any other questions, do let me know in the comment section. And it is important that you follow all this. If you are really considering, you read all the guidelines and documentations provided by them, because while I'm making this video, the rules are something and it might change in 2 to 3 months, who knows. So that's why it's important to keep yourself updated, and then that's why you have to read all the links that I provide in the description. So that being said, please like this video if you like this, and then share this with people who might find this interesting or needs it, and do let me know how can I help. And thank you for now. Bye bye.